Our next speaker, I'm really excited to be coming to hearing from, is Sharon-Ann Phillips, and she is an author, a poet, a Macmillan advocate, and she is kindly going to share her patient experience and her story with us. So, thank you.
Welcome. Thank you for having me, Nate and Libby. So I haven't got much time, so I'm going to kind of whiz through and tell you just a little bit about me before I tell you about my cancer story. I'm an author and a poet. I wrote my book in 2018, and I'll tell you a little bit more about that. I'm one of 12 children with my late parents, and I don't know if you can spot me. Third from the left. And so I grew up in quite a large family. I'm also a mother of 3 adults. My daughter's the youngest, and she's actually a medical student, and I think by next week she should have finished her last exam, so I'm really proud of her, and my sons are both professionals. I've always been quite sporty and energetic, and I was in the gym 3 times a week, boxercise, grew up running in the Nationals and Peloton and all of that. I'm also, I was running my own business, a Caribbean restaurant, bakery in Oxford, and as well as working corporately. And that was about 10 years ago, and when I first noticed that I was suffering from a shortness of breath. That was me in 2014. It was during those times when I was working corporately that I started to think I couldn't walk and talk at the same time. And so I visited my GP. In 2014 and explained what was going on, and I was told that I was suffering from anxiety and stress. By 2014 October, I couldn't walk, I couldn't talk at the same time. I actually walked into my local hospital with palpitations and shortness of breath. They did blood tests and realised that there was some abnormalities in the blood, and I was in hospital for 5 days. They did all sorts of tests, angiograms, echoes, all sorts of tests. I was in hospital for 5 days. Yet I was discharged after 5 days with no medication and no diagnosis. So thankfully, in February 2015, I had a really bad pain in my left torso and walked into a hospital again because it was really bad. I was admitted overnight and again discharged the following day with no diagnosis and no medication. I later found out that I was suffering from shingles, which was connected to the disease that was diagnosed. About 5 months later, a friend of mine, who is a black GP, she looked at me and she said, "There's something wrong. Get yourself referred to St George's in Tooting. There is a system called Choose and Book, and with that system you can get yourself referred. I had no idea about this system. I used it, and within a couple of months I was seeing a consultant at St George's, and who asked the right questions. He said alarm bells were ringing for me. I was 51 then, and he said alarm bells were ringing. You know, you've gone from being quite fit, to not being able to walk up a flight of stairs without a shortness of breath. We need to do a series of tests. And he called me in, did all sorts of tests. And one of the tests that he did was the MRI. And it was the MRI that we had requested a year before, where at my local hospital told me it wouldn't be necessary. And it was this MRI that found a rare condition. and it was called amyloidosis. And amyloidosis is actually a condition where particles had lodged themselves. It can lodge into any organ in the body, but in my case, it lodged itself into the lining of my heart. And that's why I was getting shortness of breath, because my heart was being damaged. They then wanted to know where the amyloidosis actually came from. And because it can be hereditary, it was unlikely that it would be hereditary for me because of my age. However, they still did tests. I was called into UCL, the Royal Free Amyloidosis Centre in Hampstead, and they did a whole barrage of tests there. They found out that it wasn't hereditary. Unfortunately, it stemmed from multiple myeloma, which is a type of bone marrow cancer. I was then called into hospital as an emergency to have treatment, and I was under the cardiologist there and the haematologist, and they had to give me chemotherapy quite rapidly. However, because my heart had started to become damaged, I needed to be under the cardiologist in the heart department of the hospital, and they monitored me 24/7 whilst I was having that treatment. After 4 weeks in hospital, my consultant, Dr. Anderson, came into me and she said that because my heart was so damaged, they would give me 6 months to live. That was in 2015, December. Thank God I'm still here. And she then, well, lots of things happened, but I was then rushed home to spend what they thought would be my last day, last Christmas with my family. Thankfully, by 2016, the myeloma went into remission, and it was in remission. It was in 2018 that I decided that I needed to write my memoir to bring awareness of misdiagnosis, because it almost cost me my life. And I became an inspirational speaker at that time to mainly bring awareness to misdiagnosis, but also once I started writing my memoir, Why Me? My Fight for Life from Heartbreak to Hope, I also shared a lot about my upbringing and my family. I also became an advocate at that time for Macmillan. It was in lockdown 2020, and these images were taken in lockdown, and we had a campaign for Macmillan, and thankfully we raised almost £800,000. I also share my story as part of the anti-cancer treatment for the nurses training on a quarterly basis with their training programs. But in October 2020, whilst trying to stay safe in lockdown, checking my breast, I found a rapid growing lump. It turned out to be grade 3 cancer. It was the last thing that I expected. I thought cancer, again, a different cancer, and apparently it was unconnected. I had chemotherapy I had a lumpectomy in December 2020. Then I had chemotherapy in the January, February, March, April, up to May, and I think that's when I had my radiotherapy up to May 2021. We then found out that the myeloma that was in remission had relapsed, and in August 2021, again, I started chemotherapy for the 3rd time. What worked well? The team at St George's coordinating the treatment whilst being under 2 major departments, cardiology and haematology. They worked really well together. The right hand knew what the left hand was doing. I was consulted on every step of the way, and I was able to have an input in my treatment and my family. We would have meetings, endless meetings. St George's Hospital actually saved my life. Misdiagnosis cost me my life. Almost cost me my life, I should say. I'm still here. It was a year after the symptoms, a whole year before I was diagnosed. And as a result, my heart is so damaged. I have a pacemaker and I have a defibrillator implant. From the initial consultation with my GP and the doctors at my local hospital, if I had been listened to, my heart would not have been so damaged. I now have stage 2 heart failure. It's important to listen properly to all patients and to respond to what they are actually saying. My GP never asked me anything about my lifestyle, what I was doing. I was just told that I was suffering from anxiety and stress. Black women in particular are commonly dismissed, and not just with giving birth. I believe that being black and looking much younger than my age may have affected how I was treated. I was affected by this illness at an earlier age. Amyloidosis typically affects people over the age of 65. And so this disease was rare, it is rare, and it's harder to detect in me for numerous reasons. I'm now 61 this year, and 10 years ago, I looked as if I was in my 30s. Thankfully, I had a GP friend at the time of misdiagnosis who was able to signpost me to the Choose and Book system, which enabled me to get the referral to St George's, where I was able to have my life saved. Sometimes the type of support available might not get mentioned when we are in the room. It would have been beneficial to have been offered a choice by my GP at that time. I now work part-time. Where am I now, I should say? I now work part-time as part of Myeloma Insights panel for Pfizer UK. I volunteer by sharing my story for the nurses, as I've said before, and I volunteer at my local church as a bookkeeper. I lost my job 10 years ago. I was working for a construction company, but I'm here, and so I keep going. To learn more about my journey, please do ask me about my book. It's here. It was published in 2019, and there's a lot more in there than what I've said in 15 minutes. So thank you for listening.
Thank you. That was truly, truly inspiring, and really thank you for sharing that story. It's hard to hear about the misdiagnosis, and that. Do you feel that? I just want to ask you a quick question, if you don't mind. Do you feel that may have changed, that where you're diagnosed, where you're misdiagnosed? Do you think there's been any progress? That they're hearing more?
I would hope so.
Yeah.
I do share my story to bring awareness. I think my GP, she is aware of my story, and hopefully they are doing more to make sure that, we don't go through what I went through. It has been a long journey and it has been difficult. But I would hope that by sharing stories like this, that it does bring change.
Yeah. Well, thank you on behalf of all the healthcare professionals. You sharing your story really does help.